is the Emergency Medical Minute.
So it looks like it's ST elevation, probably 4 boxes in leads V2, 3, 4. The presentation was for STEMI. Obviously that was called in as a cardiac alert. When the patient came in, the history was that she's 85, no history of cardiac disease, and had actually 3 days of symptoms, and most of her symptoms were 2 to 3 days ago, which sounded like an MI, and still some persisting symptoms that she finally told nursing staff about. So they did an EKG and they did a troponin, and the troponin came back at 30. Patient came in here, minimal chest pain, and then on exam had a loud holosystolic murmur and had some evidence of heart failure. The repeat EKG showed a similar pattern. So what's inconsistent about a STEMI with that presentation?
Normally they have chest pain.
Yeah, normally they have chest pain. This patient had chest pain several days ago. Normally it takes about 4 to 6 hours for the troponin to elevate, and this patient already had a troponin that was at least 30, but maybe coming down from 30. And then the patient presented in pretty significant heart failure with a loud holosystolic murmur. So as far as ST elevation, generally we think of STEMI, transmural myocardial infarction, but there are other things, notably like pericarditis, or sometimes people talk about like a left bundle branch block pattern, or LVH, which can have ST and T wave changes. But the other big condition that can present with ST elevation is what she ended up having, which is left ventricular aneurysm. Have you guys seen that before or heard of that? So it ends up that, hers was a classic presentation in that she had, a more remote cardiac event a couple days ago, presumably based on her history. It does start as a STEMI, but as I have in these pictures. So I'll show you here in the cross section. So this is your left ventricle, and it should all have sort of the same thickness, and you can see here there's aneurysmal dilatation there, and here you see it in cross section at the apex of the heart. And so what happens is, the heart dies, but because of increased pressure on the wall, you start to get bulging of the left ventricle, and that classically gives you that type of ST segment elevation. And importantly, on the EKG, what you can see, generally, if you have a STEMI, you do not have Q waves in those leads. So as we pass that around again, the classic presentation is Q waves in the leads where you have the large ST segment elevation. So Q waves, as you can recollect, signify a completed infarct. So now you have a completed infarct, all this tissue has died, and then aneurysmal dilatation. And then she had a loud holosystolic murmur, because it ends up that, this is the mitral valve, and this is where these are the papillary muscles, and what ends up happening is if you have this dilatation, then these papillary muscles, there's dysfunction, and then you get massive mitral regurgitation where you're going through this dilated ventricle back through the mitral valve when you're pumping. So she had a loud holosystolic murmur. Whenever her heart would beat, you'd hear through the whole chest. So that's why she had a back of blood into the lungs, so significant heart failure. So in terms of the treatment, she does not go to cardiac catheterization emergently. And if she was admitted, she would have got a cardiac echo. And if your EF is less than 20% and more than 30% of the wall of your heart is involved, then you go for this procedure, which is called the door procedure. Basically, they do open heart surgery, obviously, and they resect the area of infarcted myocardium. They use felt, purse string sutures, and close it up. So it's sort of an interesting case of what was a presentation for a STEMI that did not end up being a STEMI that required emergent cardiac intervention. It was a presentation of a left ventricular aneurysm with significant mitral regurgitation and heart failure. And the natural history of it is that it does not get better. And if a patient is an appropriate surgical candidate and has those criteria of an EF less than 20%.
I'm assuming she didn't with her age and everything.
She didn't because of her age, right? So it was her age. It was sort of her advance directive, shared decision-making with family. She was actually made comfort care only, and then went back to her nursing facility.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.